Good morning, everybody, and welcome to this week's update on our public health and regulatory information on events and festivals. Great for you to join us again today. Gemma, thanks again for being part of this. Hope you're well.
No problem. Morning, everyone.
And just to remind everybody, the criteria we set up back in March of this year in terms of our decision making around events and festivals, and a really big thank you to so many of the organisers who have be part of our conversations and taken on board some of our advice and guidance to make your events and festivals as safe as they possibly can be. And we've had some great success over the last few months. So hopefully we can keep this information going for you. Gemma, shall I pass over to you? You can give us an update in terms of where we are on current rates and vaccinations.
Yeah, no problem. Okay. Got a bit of a zoomed in version. I'll go back to all time. So I'll start as I normally do with the rolling rates per 100,000 population, and I will zoom in because it's all a bit complicated. So there we go. So this shows the last sort of 3 weeks of activity. So obviously the peak within kind of middle of July, which we were all aware of, linked to the lifting of restrictions, most likely. And then we've had quite a rapid decrease in COVID cases then over the last kind of week or two, which is really, really positive to see. Obviously, it's a good time of year, and lots of kind of benefits of the vaccine, etc. So that's good news. And if I have a look at the vaccine coverage, so in Warwickshire at the moment, we have 82% of people in Warwickshire have had their first dose, and then we've had 68% of people with 2 doses. So that's really good. Obviously, the more the merrier. And again, looking at the age categories, we're doing fairly well now with the 40 to 49s. Still a bit further to go. And then obviously the 30 to 39s and the 20 to 29s still requiring that kind of really big push, as we've mentioned before, especially, generally tend to be the working age, young families, etc., people who have children in school. So just kind of a really, really big push there is required. Would always recommend with people who are running events, you're in quite a unique position to promote vaccines as well. Certainly, thinking about conditions for entry, if you so wish, or strong recommendations really. So just to help push that forward and get those numbers up.
Yeah, it's a really important message, isn't it? And I don't know what your thoughts are in terms of the recent government announcements in terms of 16 and 17-year-olds being able to get their first dose. Certainly the figures we were looking at, going back to your charts, that time period that you were showing on that very clear time period, very much tied in with increased social contact, didn't it, at a community level, people going out, much more social mixing, which is people have been so much looking forward to. Obviously, it was coming up to the end of the school summer term period, and that certainly we were seeing an impact, some great work being done by schools. We were certainly seeing an impact of transmission within that school age children. And obviously there was other events going on at the time, such as the Euros, where there was a lot more people coming together, to celebrate our success. So I think that it's a good indication, isn't it, that actually the 16 to 70-year-old vaccination is going to be a real benefit for us. I don't know what your thoughts are on that.
Absolutely. And I think thinking about that age category as well, and the time of life where you're at that age, and I think the disruption that this has caused for a lot of young people. I think it's really important to kind of push that along and allow kind of a reintroduction to normal life, especially for young people who've missed out on so much. So yeah, I think it's brilliant.
Yeah, I completely agree with you. I was looking to see what the criteria was for traveling abroad recently, and of course, this is where practicalities of life and the vaccinations start to kind of really impact, isn't it? Because the moment you go to book a flight on an airline, the first thing it's going to ask you to do is what are the age, and of course anybody who's beyond 15, 16 is very much treated as an adult anyway. So not having the ability to have passports, etc., becomes really important. If we're asking young people to do LFTs or PCRs to attend events, the opportunity to be vaccinated actually is a much more important approach, isn't it? And I think from what I've heard you say before, Gemma, is some of the obviously the big impacts on the vaccination is what's happening in our hospitals and our ICUs at the moment.
Yeah, so just from sort of looking at the figures, it tends to be that kind of COVID cases in hospital in general, so not specifically on the ICU wards. Obviously, numbers have increased in line with community transmission, which we would expect. But then, sort of looking at our ICU numbers at the moment, they tend to hold quite steady. It tends to be kind of very small numbers and small fluctuations, which is suggesting that patients are moving through. And not kind of holding. When we were at the peak of the pandemic, you know, those numbers were holding and increasing to quite alarming levels, and there wasn't a lot of movement in and out of the wards.
Yeah, it's a really well made point. So yes, another huge benefit to you know, to keep the message going about get vaccinated. You know, when the rollout comes for 16, 17-year-olds, certainly massive encouragement to get people vaccinated for all those different reasons that we've just been talking about. And if you are planning an event and you're, as we've said before, if you have a particular target audience, you know, come and talk to us. Lots of events have used LFTs, in some cases use of PCRs. We did a fantastic piece of work with Warwick University in terms of one of their events. You know, a much younger age range of people attending that, but actually the introduction of LFTs and then PCRs really helped us identify those people who may have been COVID positive and actually kept others safe by keeping them away from the event. So that's a great example about event organisers working with us, you know, really going the extra mile to make their event as safe as possible. So yeah. Thank you again, Gemma. As always, if people want any help, please come and contact us, and hope your event is successful, and we'll keep the updates going. Take care.
Thanks, Jonathan.